I'm Jake, I'm an MSK physiotherapist and a first contact practitioner. This video today is just to talk over osteoarthritis or age-related changes, wear and tear, specifically focusing on the lower limbs, so the hips, knees, ankles and toes. So generally what we're talking about as the symptoms to begin with is pain in the legs. Generally have some swelling sometimes around the joints, which can make movement and function limited. You can have a reduced range of motion and stiffness, which tends to be worse first thing in the morning and sometimes at the end of the day or overnight, particularly when you're static for periods of time. And what we say alongside this to counteract this is to keep yourself moving in small amounts throughout the day. So we use this term called motion and lotion, which essentially refers to keeping the fluid within your joints moving. We have this fluid in our joints called synovial fluid, which is a bit like egg whites and acts as our lubrication mechanism, and it just keeps everything moving smoothly. As we age, as our skin wrinkles on the outside, our body tends to wrinkle on the inside as well, and it's usually a product of our lifestyle and what we've done in the past. Being overweight has been shown to be a factor in how we can control our pain and symptoms. So we recommend that weight loss strategies can help reduce your pain, help you manage your symptoms in a more effective way. So essentially, exercises, provided that they're optimal and suited for each patient individually, has shown to be one of the most positive things for osteoarthritis. So provided that we're getting the Goldilocks porridge just right for your amount of exercise and activity throughout the day, it should help you have the skills to manage your symptoms effectively, to allow you to keep doing the things you want to do in a manageable way. Soreness and stiffness is expected at times. This can be related to things you've done that may be atypical to your normal pattern if you've suddenly overloaded things, and can just be a product of how you're feeling at that time, or it be sort of stress related, lack of sleep, poor nutrition at that time, and these are all things that can play a role in the symptoms you might be experiencing. We sometimes feel that we have to implement strategies to modify your activity slightly. So as previously mentioned, if you're doing things like gardening, or you enjoy walking or running, those sort of things, it's not necessarily that will stop you doing those things. We want to encourage you to keep doing those things in a way that you can manage more effectively. So for using gardening as an example, it may be that you're not doing a 2-hour stint all the way through, but you're taking regular breaks every 20 minutes just to allow yourself to change out of the position you're in, offload those joints that are affected, give yourself a bit more of a break and allow it to be more manageable. So a lot of the causes of osteoarthritis tend to be more of a genetic factor and also a product of our lifestyle in general. We tend to be a product of our lives. However, being said, there's no factors being linked between, no association being linked between the sporting backgrounds and certain types of injuries, provided there's not been a massive trauma to that area that can lead to obviously excessive wear and tear or age-related changes in that area. Things to look out for that we may need more input from your GP or a visit to hospital would be things like the joint being very sore to weight bear, being very hot and red. This can be a sign of a septic arthritis, which should indicate an infection in that area, and you're severely losing function. If that tends to be something that you're aware of or noticing, we recommend that you speak to your GP or call NHS 111 number. Just to summarise, these sort of issues are normal throughout the general population. Age-related changes, we call it. The thing to take away is motion is lotion. So keep yourself moving in small amounts that are manageable for you. It's important to take your pain relief if you're advised to take that, whether that be over the counter or prescribed from a pharmaceutically trained professional, just to help you manage the things you want to do. Keep yourself moving. You may have to change the way you operate your daily routines to make it more manageable and chunk it out more. If you have any more concerns, speak to your doctor or call 111. And if you want more information, the NHS Choices website has a whole host of information that will be really helpful for you. If you search osteoarthritis on there, there'll be some useful resources for you. Or you can visit our website, which is www.purephysiotherapy.co.uk. We have a list of conditions at the top of the screen where you can go and click on. We provide a whole host of information on there and some exercises, again, that you might find helpful. Thanks for your time.